families with cerebral palsy. A breakthrough treatment has taken off using stem cells as an effective way to combat the symptoms of cerebral palsy. But before we get into that, we turn to Caroline and Ariana, who will give us a breakdown of exactly what cerebral palsy is.
Today we're going to discuss a condition that affects millions worldwide, yet remains widely misunderstood: cerebral palsy. Cerebral palsy, or CP, is a complex neurological disorder that impacts muscle movement, posture, and coordination. It is caused by damage or abnormal development in parts of the brain that controls movement, typically occurring before, during, or shortly after birth.
Firstly, let's dive into the definition of cerebral palsy. It is essential to understand that CP is not a single condition, but rather a group of disorders with varying symptoms and level of severity. The most common types include spastic, which is characterized by muscle stiffness and rigidity; dyskinetic, marked by involuntary and uncontrollable movements; and ataxic, which affects balance and coordination.
Diagnosing cerebral palsy requires a thorough evaluation by healthcare professionals. While there's no specific test for CP, doctors rely on a combination of medical history, physical examinations, and neurological assessments. Early signs may include delays in reaching developmental milestones, such as rolling over, sitting up, or crawling. As children grow older, symptoms become more apparent, leading to formal diagnosis.
Now, let's explore the various aspects of treatment and therapy for individuals living with CP. The goal of treatment is to manage symptoms, improve mobility, and enhance quality of life. Early intervention is key, as it can significantly impact long-term outcomes. A multidisciplinary approach is often employed, involving a team of specialists such as pediatricians, neurologists, physical therapists, occupational therapists, and speech therapists.
Yeah, and physical therapy plays a central role in the management of cerebral palsy. It focuses on improving muscle strength, flexibility, and coordination through targeted exercise and activity. Occupational therapy complements this by addressing difficulties in daily living skills such as dressing, feeding, and grooming. Additionally, speech therapy helps individuals with CP overcome communication challenges and improve their ability to express themselves effectively.
In some cases, medication may be prescribed to manage symptoms associated with CP, such as spasticity, seizures, or pain. Orthotic devices like braces or splints may also be utilized to support proper alignment and function of limbs. Furthermore, assistive devices such as wheelchairs, walkers, communication aids may be recommended to enhance independence and mobility.
Yeah, for individuals with severe symptoms or those who do not respond to conservative treatments, surgical interventions may be considered. These may include procedures to release tight muscles, correct skeletal abnormalities, or implant devices to manage spasticity. Beyond medical interventions, emotional support and community resources are vital for individuals and families affected by cerebral palsy. Support groups, counseling services, and advocacy organizations can provide valuable guidance, encouragement, and empowerment. In conclusion, CP is a complex condition that requires a comprehensive and holistic approach to treatment and therapy. By raising awareness, promoting early intervention, and advocating for resources and support, we can help individuals with cerebral palsy achieve their full potential and lead fulfilling lives.
Great. Thank you so much for that wonderful breakdown. We now turn to the staff from the neurology team at UPMC Hammond to tell us exactly how the new treatment could change the face of cerebral palsy diagnosis.
Cerebral palsy is not a diagnosis that any family wants to hear. Since there is no cure, it can be hard to find good treatment to help the patient as their disease progresses. In most cases, our first line of defense is physical and occupational therapy. Good thing I'm a physical and occupational therapist. This therapy helps improve symptoms for many children as young as infants up through grade school. If physical therapy is not enough, a rehabilitation specialist or orthopedic doctor, such as myself, may recommend your child to use a brace or other orthotic device. These devices make moving much easier and allow patients with cerebral palsy to be more independent. A medical professional, such as myself, may prescribe an oral medication such as diazepam or baclofen, which helps relax the muscles. They can be given through a feeding tube if the patient has any problems swallowing. After considering all of these treatments, we may look to surgery. Different surgeries can relieve many symptoms of cerebral palsy. Most commonly, surgeries that fix scoliosis and relieve stiff muscles can help to improve the quality of life in cerebral palsy patients. I can help with all of your problems. I am a good doctor. Please come to my clinic. Here at Scully's Orthotic Prosthetics, we provide stable prosthetics that can help improve your quality of life today. Have cerebral palsy? We got you. Lost a leg to an alligator? I'm your guy. Want to become a cyborg? Come down. Come stop by at Scully's Prosthetics on 1234 State Street in Erie, PA for all your prosthetic needs. Not liable for any injuries occurring due to our devices or any complications arising from our treatment. Cash only and absolutely no refunds.
In cerebral palsy and many other neurological conditions, neurons and oligodendrocytes die or fail to mature, and the white matter tracts that connect various brain regions become damaged. The cortical spinal tract, which connects the motor regions of the brain to the spinal cord and helps control movement, is often damaged. Without functional cortical spinal tract connections, motor deficits are sure to follow. Stem cell transplantation is a regenerative therapy that has the potential to replace the damaged and non-functional cells in the brains of cerebral palsy patients, as well as to provide support to the remaining neurons and oligodendrocytes. Stem cells do not provide an ultimate cure for the disease, but can change the cells that they come in contact with that are ultimately dead or damaged. This treatment slows the progression of the disease, and new research shows that it may completely stop and make the disease regress.
Hearing this, some parents may be worried about their child being diagnosed with CP. So we're going to show you some ways you can assess your baby at home as a screening tool for CP.
For babies up to around 20 weeks of age, the best screening tool is called the General Movements Assessment. This easy test consists of lying your baby on the back and simply watching the movements unstimulated.
Another test you can complete is called TIP, the Test of Infant Motor Performance. This assessment goes through many positions for your baby, like lying on their back, rolling onto their stomach, laying on their stomach, sitting, and even standing to see how much weight they can take through their legs.
Yeah, and the information obtained from these assessments is compared to other babies that have had the same test at the same point.
As your baby gets older, another test called the Hind Test, or the Hammersmith Infant Neurological Exam, can be used to assess your baby. This test examines the child's muscle tone throughout the whole body.
The most important thing to do if you're worried about CP when watching your baby grow is to examine their social skills, language, and thinking skills. In young children, muscle imbalances may be hard to truly detect, so other deficits may be the first inclination for this disease.
Wow, that was a great segment on CP.
No, it really was, but I feel like there's still a lot more to learn. What do you think?
I think we could learn more.
Yeah, so let's welcome our special guest, Nurse McKenna.
Hey, McKenna!
Let's go, McKenna!
Hi. Hello. Today I'm going to show you what those tests are that you talked about today. So the general movements assessment, you simply take your baby and you lie them down and see how they react. He's not doing so hot. The next one is the TIMP test. For this one they need to be a little bit older, and you would lie them on their back, see how they do rolling onto their stomach, and then stand them up. He's not doing so great.
Wow, thank you so much for sharing that with us. You know, it's really medical professionals like you that just give the knowledge to the population, so we really appreciate that.
Thank you.
Thank you for coming on our show today.
Yeah.
Here at Scully's Physical Therapy, we provide the best physical therapy in town. Fell down a flight of stairs and broke your leg? I'm your guy. Trying to punch your sibling and you broke your arm? Look at this guy, I can fix it. Got hit by a drunk driver? I'm your guy. If you need a lawyer, please hit me up at 1-800-716-712-7470. Not liable for any injuries or complications resulting from our treatment. Side effects may include pain, loss of strength, and loss of range of motion. Cash only and absolutely no refunds. Have a good day.
That's amazing. Who knows where the world of medicine will turn to next? In other news, a local doctor is seen skateboarding down a busy street, Erie Street, stating that he was late to work. Oh my God, is that Dr. Scully?
Occupational therapist. I'm a good doctor. This therapy helps people improve. Damn it.
The assessment goes through many positions for your baby, like lying under Like, fuck. Text.
Stem cell. I did it again! Stem cell.
Not liable for any injuries occurring due to or fuck.
Treatment that has fallen. Ah, fuck.